Hello, my name is Joanna Schreck. I am currently in the ABA program at Ball State University in the course SPCE 683-803 with instructor Dr. Nicole Weekly. Let's begin with the client profile. For the case study purposes, I will use a different initial, JS. JS is a 4-year-old boy that has been diagnosed with ASD. He currently goes to school and then has ABA services in the center. For example, he goes to school until 12, then begins ABA services around 12:20, 12:30 until 4 p.m. He does not take any medications or have any other conditions known. Behaviors of concern include aggression, items in mouth, and tantrums. I will go in depth of behaviors of concern and integrate with the BACB task list. First, C1, create operational definitions of behavior. C4, measure temporal dimensions of behavior, examples, duration, latency, inter-response time. And H1, develop intervention goals in observable and measurable terms. First behavior is aggression, and it is defined as any actual or attempt instances of hitting self or others with hands, fists, and or kicking. Items in mouth, any actual instances of having items pass the mouth lips. And last one, tantrums, any instance of crying, laying on the floor, yelling, and or kicking for more than 5 seconds. Integrating the task list with F3, design and evaluate assessment of relevant skills, strength, and areas of need. F6, design and evaluate functional analysis. F8, interpret assessment data to identify and prioritize social significant, client-informed, and cultural response behavior change procedures and goals. The assessment tool used is the VB-MAP for this client. The VB-MAP skill assessment contains 170 verbal behavioral milestones, 16 different verbal operands and related skills, and it's broken down in 3 development levels, 0 to 18 months, 18 to 30 months, and 30 to 48 months. This is including the 30 to 48 months, which is the 3 to 4 years old, which is perfect for the client in this point in the study. Common learning and language barriers include instructional control, behavior problems, defective MENDS, defective tags, defective motor imitations, defective echoics, defective matching to sample, defective listener response repertoires, defective introverbals, defective play and social skills, prompt-dependent long latencies, scrolling response, defective scanning skills, and failure to make conditional discrimination. Possible maintaining contingencies with integrating the task list G2, design and evaluate differential reinforcement. For example, DRA, DRO, DRL, DRH, procedures with or without extinction. So the first possible maintaining contingency for aggression is hypothesized to be denied access to a tangible. The antecedents that has been in place is to identify any precursors and then give visual aids or verbal reminders when items will be removed. And the consequence is differentially reinforcement of alternative behaviors. The replacement behavior that we are trying to teach is functional communication. So asking for a desired item, asking for a break, or delayed gratification. So possible maintaining contingencies for items in mouth. The hypothesized function is sensory or automatic. The antecedent is removing items that are potentially small or is known for the client to be that has put in their mouth, and using verbal reminders on how to play with the items. So before presenting a toy with smaller objects, like, okay, we're gonna play this way, and then the consequence is differential reinforcement of alternative behaviors, like, oh, good job playing with this, and keeping that momentum going. A replacement behavior is functionally communication, asking for appropriate chewy or item to be able to place them in their mouth. So possible maintaining contingencies for tantrums. The hypothesized function is escape and or attention. The antecedent is identifying precursors, giving visual aids or verbal reminders to use functional communication. Consequence is differential reinforcement of alternative behaviors. The replacement behavior is also functional communication training, so asking for a desired item or asking for attention, asking for a break. So the current goes integrating the task list with G7, selecting and evaluating stimulus and response prompting procedures. So by example, teaching an error list, most to least to most. And G12, selecting, implementing, chaining procedures. Based on this assessment scores, he is currently working on name response, mending with noun and verb combination, greeting peers and adults, listener responding, interverbals, matching, tacting, self-help skills. So self-help skills, he's currently doing toileting, potty training. So he is using a chaining procedure.